Hey, hi guys. Just checking audio and video. Everything okay? Hey guys. So this is the just a quick discussion of the quiz that we had just now. Okay. So the question number one on the screen was this is basically for all those who have attempted the quiz. You have been doing these questions. So this is just a quick revision for them. Okay. So okay, right, guys. So this was actually a 59. Okay, so this was a 59-year-old female who underwent hysterectomy and salpingo-oophorectomy for ovarian torsion and endometrial atypical hyperplasia. यार पहली बात तो याद रखो post menopausal female every time whenever they give you a history that they are presenting with endometrial hyperplasia. Okay, this is probably due to estrogen excess. Okay, so you should think of tumors which produces a lot of estrogen, and first possibility in this case should be granulosa cell tumor. Always remember that. Okay, apart from that, you should always remember that now they've given you that this is an ovarian mass and which is the mutation, and on the inset you are seeing that follicle like structure. Remember bacha log, follicle like structure lined by the epithelial cells which have grooves in them. These are very typical bodies called collexner bodies, which are seen in granulosa cell tumor. Remember that the mutation that is associated with them is FOXL2, and the marker, the IHC marker, which comes out positive is inhibin. So diffuse positivity of inhibin, that was another question, is very typically seen in granulosa cell tumor. Okay. Apart from that, what are the other mutations here? STK11 is basically seen in Peutz-Jeghers syndrome. CDH1 is basically seen in diffuse gastric cancer and lobular carcinoma of breast. And BRCA1 and 2 are associated with epithelial ovarian cancers. And so remember, they are epithelial ovarian cancers. This is one thing that you should always be remembering. Okay. Okay, guys. So diffuse cytoplasmic inhibin. So point here to be noted is inhibin comes in cytoplasm. Okay, because that was a question last time also. So inhibin positivity usually comes in cytoplasm and it is seen in granulosa cell tumors. Okay. Okay. So apart from that, you have to remember Schiller-Dugel bodies are the bodies of yolk sac tumor. Yolk sac tumor in males have a very good prognosis, okay, and they usually occur in males less than 2 years of age, but in females, yolk sac tumor does not have a good prognosis and usually occurs in middle-aged females. Okay, so that is one thing you have to always remember. Okay, and choriocarcinomas are associated with syncytiotrophoblasts, cytotrophoblast and extensive necrosis. Apart from that, morphology, you have to remember choriocarcinoma in males is a tumor which usually does not present with a testicular lump. Okay, so remember which testicular tumor in males does not present with a lump, it's choriocarcinoma. And remember, testicular tumors usually should not undergo FNACs. Okay, so testicular tumors usually should not do FNACs. Even ovarian tumors, its FNACs are contraindicated because they can spill into peritoneum from ovaries and from in males, and from testes they can spread to the skin. That's the point that you have to remember every time. Okay, and what is choristoma? Ectopic presence of any tissue is called choristoma. Okay, like endometriosis is an example of choristoma, that is endometrial tissue present anywhere outside the endometrium, like in umbilicus, a female presenting with an umbilical bleeding, and on biopsy you see endometrial tissue. This is an example of choristoma. Okay. Chalo, next question. Okay, so coming to the next question, so we have talked about CDH1. Look at this morphology, guys. This is signet ring cells. You can see the nucleus pushed to the periphery and it's hyperchromatic. So this morphology is signet ring cells, and whenever you see signet ring cells and they give you a history of bilateral ovarian masses, you should always think of Krukenberg tumors. Krukenberg tumors are metastatic tumors to the ovary, and most of the time this metastasis is coming either from the breast or from the gastric tissue, and the mutation in case of diffuse gastric cancer or lobular carcinoma of breast is CDH1. That is one thing that you always have to know. Okay, so that is the point that you have to remember. Again, looking at the other mutation, STK11 is basically for Peutz-Jeghers syndrome, BRCA1 is for epithelial ovarian tumors, and FOXL2 is for granulosa cell tumor. Okay, sure. Now this was an interesting question that I had given. Okay, so this is a basically practical question. Agar suppose BRCA1 or BRCA2 hereditary breast and ovarian cancer, very popularly this is called as HBOC, and this should be suspected in individuals with personal or family history of any of the following except, okay, so what did you mark this as the answer, guys? So everybody should remember here that there is a proper guideline which I'm showing you here. So what is the guideline here? So when should you suspect this? Whenever a female has a breast cancer diagnosed before the age of 50, ovarian cancer, which ovarian cancer? Epithelial ovarian cancer, or a fallopian tube cancer, or a primary peritoneal cancer. ठीक है, तो हमेशा BRCAs are associated with epithelial ovarian cancers. Okay, apart from that, even in male breast cancers, you should suspect BRCA1, BRCA2, hereditary breast and ovarian cancers. Apart from that, 2 or more related with breast cancer and 1 diagnosed before the age of 50, or 3 or more relatives with breast cancer of any age, कोई भी age में हो, ठीक है? And if you have diagnosed a family member with BRCA1 or BRCA2 pathological variant, either on next generation sequencing or any molecular testing, you have identified that anybody in the female have this BRCA1 or BRCA2 pathogenic mutation. So remember, these are the criteria for which you have to remember. Also, you have to remember that any person who presents with a combination of pancreatic and or prostatic cancer, okay, with breast cancer or ovarian cancer, these are the also group of patients where HBOC should be suspected. So this was the question that was given, that when will you not suspect it? So the answer to this question is germ cell tumor of ovary. So germ cell tumor of ovary में आप नहीं suspect करते हो HBOC. Okay, so breast cancer before the age of 50, male breast cancer, any epithelial ovarian cancer or fallopian tube cancer or primary peritoneal cancer, all these are suspected lesions. Okay, but you do not suspect them in germ cell tumor of ovary. Remember that. Okay, now this is another question which is not a high risk gene for breast cancer. Please remember there is a separate criteria for this. Okay, so there's a separate criteria for this. So we have high penetrance genes and we have moderate penetrance gene. High penetrance gene मतलब होता है high risk genes for the breast cancers. And इसके अंदर हमारे पास mostly कौन से आते हैं? One is Lee-Fromage syndrome. All of you know that. Then second is STK11. So people think that STK11 is only associated with Peutz-Jeghers syndrome. No. Remember, Peutz-Jeghers syndrome, STK11 are also associated with ovarian tumors, breast cancers, even in cervical cancers, which is adenoma malignum. Okay, and which ovarian cancers? Usually they are sex cord-stromal tumors. Okay, so these are things you should remember. Okay, apart from that, P10, PAL-B2. Okay, so PAL-B2 again has breast cancer, ovarian cancer, male breast cancer, and pancreatic cancer. नाम ही बोल रहा है PAL-B2, pancreatic cancer and breast cancers. Okay, apart from that, ovarian भी होता है. CDH1 is lobular carcinomas of breast, and ATM are associated with high penetrance. Remember, ATM is one gene which is associated with both high and moderate penetrance. So this is moderate penetrance gene. ATM can be associated with high penetrance also and moderate penetrance also, depending upon the mutation which is occurring in them. Apart from that, जितने भी माइक्रोसेटेलाइट वाले जीन्स हैं, ओके, लिंच सिंड्रोम के जीन्स हैं, दे आर ऑल मॉडरेट पेनिट्रेंस. ठीक है, लिंच सिंड्रोम आपको याद रखना है और चेक 2 याद रखना है. चेक 2 is very important because they are usually associated with the radiation induced breast cancers. Okay, so that is one point you have to always remember. So coming to the question here, so which is not a high risk gene or high penetrance gene? Remember JEC2. JEC2 moderate penetrance gene है, radiation cancer के साथ associated होता है. P53 high penetrance है, P10 high penetrance है. I hope everybody remembers P10 is associated with Cowden syndrome. STK11 is Peutz-Jeghers syndrome. Along with it is a high penetrance gene for sex cord-stromal tumor breast cancers also. So JEC2 is moderate penetrance. इसके अलावा अगर Lynch syndrome होता है तो Lynch syndrome भी moderate penetrance में आता है. Okay, so that is what you have to remember. Okay, so next was a stat simple question which is not an epithelial ovarian tumor. Please remember epithelial ovarian tumors वो हैं जो कि किसी भी epithelium से arise होते हैं. So either it can be serous papillary tumors if they are like resembling the epithelium of the fallopian tube, mucinous tumors if they are resembling the epithelium of the cervix, okay, or they can be Brenners if they are resembling the transitional epithelium. They can be clear cell or endometrioid if they resemble the endometrial epithelium. तो these are the 5 type of epithelial ovarian cancer. Serous याद रखो, अपने फीमेल जेनिटल सिस्टम को अपने दिमाग में याद रखो. We have an endometrium जिससे endometrial और clear cell आया, endometrioid और clear cell आया, fallopian tube जिससे serous आया, cervix जिससे mucinous आया, and then bladder is there which is say Brenners आया. So these are epithelial. Remember, epithelial ovarian tumors are also positive for CA125. So CA125 is a tumor marker for your epithelial ovarian cancers. ठीक है. अब what about the germ cell tumor? So whenever we talk about germ cell tumor, remember the code CTD. Okay, CTD. So C is choriocarcinoma, embryonal tumor, okay, teratoma, York sac tumor, and dysgerminoma. So these are again the 5 tumors which are germ cell tumors. ठीक है, हमेशा याद रखो CTD. Okay, so they are germ cell tumor. Remember, the germ cell tumors are unique. Okay, they are very unique. So especially इसमें से dysgerminoma जिसका male counterpart क्या होता है, seminoma, is always asked in the question. Please remember, it will typically have that lymphocytic infiltrate and cut potato appearance. Okay, so that's one thing that you have to always remember. इसके अलावा you have to remember York sac tumor have Schiller dual bodies. That is one thing you have to remember. Okay, choriocarcinoma has extensive necrosis with syncytial trophoblast and cytotrophoblast. So these are something that you have to remember in germ cell tumor. Coming to the sex cord tumors, guys, you have to remember very easily. सब सेक्स कॉर्ड नाम ही है, सेक्स कॉर्ड, सेक्स हार्मोन्स निकालते हैं. ठीक है, या ग्रैनुलोसा सेल ट्यूमर, थीका सेल ट्यूमर्स, फाइब्रोमा, लेडिक सेल ट्यूमर्स. ओके, so लेडिक सेल ट्यूमर is like ladies like crystals, so they have crystals of ring. Granulosa cell tumor is girly tumor, secretes lots of estrogen, and they are foxy tumors, so they have FOXL2 mutation, and they usually metastasizes to the contralateral only first. Then we have thicomas. Thicomas are very unique. I had given a question on that also. So if you look at this question that I had given, okay, so this thicomas are very important because they have cytoplasmic lipid positivity. So cytoplasmic lipid positivity अगर आपको दिख रही है, येलो कलर का ट्यूमर दिख रहा है, and very typically pericellular, हर सेल के अराउंड रेटिकुलेट फाइबर्स है. This is very characteristic of thicoma. Okay, so thicomas are very important tumor because they can give you the question like which is the ovarian tumor which secrete which is positive for oil residue. So remember, it is thicoma, which everybody should be very clear. Okay, so that was about your thicomas. Okay, fibromas are whitish tumor and they are usually fibrous. So if they are, and this was another question, now you know this answer. Ring crystals, ladies love the crystals, so Leydig cell tumor will have the crystals. Thicoma have cytoplasmic lipid. Granulosa cell tumor, foxy tumor with collexiner body. So collexiner bodies are follicle like bodies with grooved nuclei, coffee bean nuclei, because girls love coffee. Okay, and fibromas are very whitish tumors. Okay. Coming to the next, so this was the question which is not an epithelial tumor, which we have already discussed. The answer to this question is dysgerminoma, which is a germ cell tumor, right? So with that was the questions of ovaries which can be asked today. So basically this is the mode in which we'll be revising now, because there are very few days left now. So let's quickly revise some topics which are high yield topics in exam. So if you like this, do let me know this mode of revision is good for you. We can revise more and more like this, and I can post more questions. But first I can have a small quiz and then we can discuss. Do let me know if you love this mode. We will continue like this till your NEET PG exam. Right, guys? With that, bye-bye, good night. And if you have any doubts, you have my WhatsApp groups. Please message in the WhatsApp group, or you have my Instagram, message in the Instagram. I'll love to answer your queries. With that, bye-bye, guys.